Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we are going to discuss, the topic that many Indian medical coders are interested in. So I receive hundreds of messages asking how to get a medical coding or insurance coordinator job in UAE or Qatar. So that I have decided to give you the complete roadmap which I followed. So I also got two opportunities through reference through my colleagues, but it was on site, so I did not take up those opportunities. But I know the process, so I'll be explaining today. So please do watch video till end. And if you like the information, please do subscribe to my YouTube channel. And also please do share with your medical coding friends. So let's begin. So first, let me quickly show you what I will be covering today. So first, we will understand whether these Indian medical coders can actually get into the job in UAE and Qatar, and also we'll discuss the educational qualification, certification, and the salary expectations, and also the healthcare systems and the coding differences. Okay, and then lastly we'll see the job portals as well. Okay, so yeah, let's begin. So as you can see this, why UAE and Qatar. So here many people or many medical coders think this UAE only hires doctors and nurses. So that's not actually true. So this healthcare industry in UAE and Qatar has expanded tremendously over the last decade. So that's why because of the health insurance has become mandatory there, we have insurances are like what to say, every insurance claim submitted by hospital which requires proper coding, proper documentation and then proper billing. So it creates, obviously it creates demands for medical coders, insurance coordinator, and this claim officers or claim specialist, and then revenue cycle executives and auditors, and the mainly CDI specialists. Okay, so you can all have a good opportunity in UAE and Qatar. So now let's see common job titles. Many candidates make this mistakes while applying for jobs for UAE. Like they'll always search medical coder jobs. So if you search only that one title as like medical coder, you will miss many opportunities. So you can see these are whatever I have mentioned, these are the common job titles that they'll use on their hiring post. Okay, job hiring post. So for example, one hospital may post like they are hiring for insurance coordinator, and while another hospital may advertise, or they'll post for coding auditor, or maybe clinical coder. Okay, or maybe RCM specialist, RCM executive, insurance officer, insurance executive, and pre-authorization coordinator. Okay, and claim coordinator. So these are all the things that when you learn both medical coding and billing, you get to see coding knowledge as well, and also the insurance aspects. Okay, how this insurance workflow will be, and together we call it as RCM. Okay, so that's why when you are preparing for UAE jobs, you must also, if you are learning in outpatient, that is fine, just get a skill in outpatient. And same way, if you are having expertise in inpatient coding, that is also fine, good, that you have specialization in IP. So whatever, whether OP or IP, keep that experience. Additionally, you should also learn about insurance coordination. Okay, we will always have that little bit of knowledge, but when we have this expertise in medical billing, we get to see in combined. Okay, so that will create more opportunity for us under revenue cycle rules. Okay, and this revenue cycle rules what you are seeing will definitely have a good salary and good opportunities in UAE countries. So make sure you know all of these job titles, and whenever you are applying, to verify all of these titles, and on this particular thing you can able to get more job searches, and then you can apply for that. Okay, so yeah, this is one thing. And next we'll see educational qualification. Okay, so I'll be very honest. Okay, so when we discuss about this qualification, Here, when we are looking into UAE and Qatar opportunities, these doctors who have done MBBS, okay, MBBS, BDS, these two people, or maybe nursing, okay, these people, and BPT, so people who have strong medical knowledge will have a higher scope compared to just a life science students. Okay, this is a very important facts that you should remember. Then how you can compete with them is the question. Like, you are just a life science, and then how you can compete with the MBBS doctor means with your medical coding experience. So if you can gain some experience here in India, and you get a expertise in particular area, like maybe you are strong in DRG coding, or you are strong in HCC coding, or maybe you are strong in surgery coding, ENM coding, likewise you should have that experience. So when you have the experience, even you are from a life science graduate, okay, like maybe MSc or BSc biotechnology, microbiology, likewise you can able to compete with the doctors also. Okay, so that is one biggest advantage, having experience. And then this MBBS doctors can actually start their career from fresher itself in UAE. But as a life science graduate, they should look for, they look for whether you have some hands-on experience in coding and billing. Okay, so this is very important. And whatever the graduations they have mentioned here, these are consider them as a having scope. Okay, and other life science graduates also I did not mention here, because I have just mentioned life science. You know that what are the specialities will come under life science and also medical. So all of us are eligible. Okay, so the mainly MBBS and BDS, mainly BDS for dental surgeon. Okay, so for that them they can have this expertise in CDT, right? Certified, CDT will have this like just like CPT, we do have dental terminologies. Okay, not like procedure terminology, but dental terminology. So that is one advantage for that BDS graduate. And then BAMS, BHMS, BUMS, BPT, nursing. Okay, nursing also will have a good scope. Okay, with your certification, nursing will also have a good scope there. And B.Pharm, M.Pharm, PharmD, all of these graduations will definitely have the scope. Just you need one more step, that is certification. Okay, you just need one more certification to just to show that you have that credibility to be a medical coder or to be an insurance coordinator. Okay, this is about your educational qualification. So next, what are the certification required? Okay, so I'll be very honest with you. So focus on whether you want to grow in outpatient setting, or OP or IP. So this is your main agenda. You have to decide whether you are strong in if you are from a MBBS, like you will already a strong, you'll already a strong knowledge in anatomy, physiology, and terminology, then you can definitely choose to go with inpatient coding. Okay, and same way you are from life science, then you have this kind of knowledge or exposure, minimal exposure. We do not have in-depth exposure, so you can go with outpatient setting. Okay, whatever you choose, you have to decide your two basic certification as mandatory. So the global certification is certified professional coder from AAPC. Okay, CPC is very very in demand. Okay, it's not like you are, if you are having CPC you are an expert, it not shows like you are an expert, but it's just a basic credential that you need to have to kickstart your career in medical coding. Okay, and same way CCS from AHIMA you can choose. Okay, if not CPC like CIC and CRC, whatever your additional specializations you are going to do, like for risk adjustment they may ask you to take CRC, for inpatient coding they may ask you to take CCS or CIC. Okay, these are all additional specialization certification, but just have one basic certification, CPC. Okay, it's not like a complete basic, it will have like it will make you have this knowledge in ICD-10, CPT, and HCPCS, so that it will help you. It's like a kind of having global exposure. So CPC will always help you to get hired. Okay, so first certification should be CPC, and after that, based on which opportunities you are getting, you can choose to go with one more additional certification. Okay, to have a better opportunities or to have a better growth in the field of medical coding. Okay, this is very important. And then uh, coming to, is CPC is alone, then again you can ask me a question like, if I get CPC, will be able to get a job? No. Okay, so CPC, as I said, it's a credential. It shows that you have learned something. Okay, but in that, how much expertise you have, you should be able to, prove to the employer. So that you have to be having, kind of good knowledge in anatomy, medical terms, ICD-10 CM and ICD-10 AM. So you can keep AM as optional. Not now only you should learn. When you move to UAE and when you have this Qatar opportunities, then only you can go with ICD-10 AM. So far not needed. But you should have a good knowledge in CPT and ICD-10 PCS if you are focusing on IP coding. Then HCPCS, medical billing. Okay, billing in the sense, at least have some basic knowledge. Okay, like in the, like if you have worked in denial management or if you have worked in AR coding, okay, or maybe pre-authorization. So all of this will help you to get good opportunities. And then along with this, you should also have good English communication skills and medical claim knowledge and insurance workflow and understanding. Okay, the entire RCM workflow you should be able to have that kind of confidence, like what is utilization review, what is pre-authorization, what is kind of what to say, when you have payment posting. So many things are there when we are talking about billing, so you should at least have some basic knowledge on that. Okay, it will have this added advantage for you. And then uh, the next thing will be like, once you start your, nobody, if you're from life science and you just finished your certification as a fresher, first you get job here in India. Okay, maybe if you are from Karnataka or Hyderabad, I mean from like what to say, you are from then Chennai, all of these, you are belongs to that particular state, then get a job in that particular state first. Okay, get experience at least 1.5 year to 2 years, then you get to know the complete workflow. Then only you have to target to UAE. Okay, then it will have a, for you, you will have more benefits rather than just being a fresher without having any hands-on experience. If you keep trying, you may feel like you are not getting job. So instead of that, you first start your career here in India. Later, once you understand the entire workflow, you will have more exposure in the subject as well. So you can go ahead and start applying for the on-site job roles. Okay. So next, salary expectations. So the salary expectations, varies based on the companies or maybe the hospital that you are working for. So the basic salary there per month, you can see insurance coordinator. Insurance coordinator is like less of medical coding and more of insurance related. Okay, so there you may start as a fresher from somewhere between 3000 to 4000 AED, and experienced can get 4000 to up to 10,000. Okay, in experience also, like starts from 3 plus years, you can start expecting around 5000 to 8000. Okay, AED, so you can convert that into INR and it will be a good money only. Okay, you'll be getting around, if it is 5000 AED means you'll get around 1.5 lakhs, something like that. Okay, you can just take a reference. And then medical coder salary will be like, if you are a coder or if you are an auditor, then definitely it starts from 4000 to 6000 initially. Then based on your experience it will gradually increase, and if you have some 15 years of experience in the same field, definitely you can expect 15,000 AED per month. Okay, so I have seen people who get that much of money. Okay, but only you should have a good skills and the leadership skills and how you handle the team, everything it depends. Like you will get to know, with experience we will able to learn a lot of things. Okay, so the initial salary you can have this reference. and then companies and hospital which are hiring. So you will have this, you can have this list, and there are so many hospitals and there are so many healthcare companies and insurance companies that hire medical coders, nothing but insurance coordinators and whatever the job titles earlier I have mentioned. All of those titles can have jobs in these mentioned hospital and companies. Okay, so you can see American Hospital, Dubai, Mediclinic City Hospital. These are all very popular hospital, and you can take some time and you can only do your research based on which location that you are choosing to get a job. Based on that, you target one particular hospital, go to their job portal or maybe go to their career portal. From there, or follow their healthcare pages in LinkedIn. Okay, so with building some connections within a targeted 3 months of time, you can able to at least get response from these hospital or companies. Okay, so this is the mandatory thing that you have to do. And when we talk about Dubai and Qatar, it's totally different. Okay, I'll explain why in upcoming slides. So you can see, you can target revenue cycle, or you can target hospital directly. You can target, if you are targeting on Qatar, then definitely whatever you have learned here in medical coding, it will not help you. You have to learn additionally, which is ICD-10 AM. Okay, all Australian modification Qatar follows, so that you need to learn. Okay, and this whatever we learned, CPT, ICD-10 CM, HCPCS will not help in Qatar coding system. Okay, and also you can target insurance companies. So just take a reference of these mentioned companies. So now you can see UAE healthcare licensing structure. So here there are three main authorities. Okay, just like when we are talking about US healthcare system, we have CMS, okay, Centers of Medicare and Medicaid. Same way here also there are authorities. The one is DHA, which is Dubai Health Authority, which controls Dubai healthcare facilities and Dubai insurance claim ecosystem. And same way DOH, Department of Health, Abu Dhabi, so it controls Abu Dhabi healthcare system and insurance regulations. And then this MOP we say MOHAP, which stands for Ministry of Health and Prevention. So which controls all of these particular locations. Okay, so we should, how we have CMS rules and regulations. When you are working for UAE, you have to follow DHA and DOH guidelines. Okay, so this is a main difference. Like you will completely switch to new regulations, new rules, new guidelines, okay, which respect to their government. And then comes to Qatar coding system. So whatever you have additionally learned, I already mentioned, once you get the CPC certified, you will have all of these basic things which can, you can work for Dubai. Okay, so but for if you are targeting for Qatar location, then additionally you should learn for ACHI and ACS and also ICD-10, ICD-10 AM. Okay, for diagnosis coding, they use not clinical modification but Australian modification. And same way for CPT also they use Australian classifications, ACHI and ACS. These are all additional things that we need to learn if you are targeting for Qatar. Okay, so the plan will be, you should not directly plan for Qatar, plan for Dubai, and first you get familiarized with the hospital and insurance regulations. Later if you want, you can move to Qatar. Okay, so that is the later part, so that you can follow. So then the top job portals include, first thing I prefer LinkedIn, because there are so many professionals in LinkedIn who are currently working in UAE countries as an insurance coordinator, revenue cycle specialist, the integrity specialist. So many of the roles we have in UAE, and they're, kind of, they have good exposure. Okay, so it is the best thing that is to start with LinkedIn, make a good connections and start asking for referral. Okay, and then you can apply for job through them. Okay, then it will be easy for you, okay, to just to move from India to UAE. And do not expect any remote jobs. Okay, I have been like I have tried a lot of remote jobs. I got remote job from USA but not from UAE. Okay, so I cannot take any on-site opportunities. Though I am getting on-site, I'm not ready to take that. Okay, so that's my thing. I am very familiarized with the work from home thing, and so I'm comfortable. So I'm just giving you the kind of details, so that at least the people who are interested to move to UAE will have this benefits from this video. Okay, and then we have all this job portals. Please utilize them. And as I already mentioned, searching while searching the keywords, whatever the job title earlier I have shown, use all those titles. Okay, at least in one of those title you can able to see something like where they want you to work on CPT, where they want you to work on ICD and CM. Okay, and the normal insurance thing. Okay, you will be able to land on a particular list of jobs. Okay, and also we do have HR, which is recruiters. Okay, you can just follow this portal also, where there will be a group of HRs and they will hire the people. Okay, so through them also it will be helpful. So then, as I mentioned, action plan. If you have recently got certified and have this 1.5 years to 2 years of experience, then plan to get one more certification. If not, just move to UAE. Like if you are already very much sure that you want to get a job in UAE, then the best thing will be 3 month plan. Okay, you have to have that financial stability. You should move at least 3 months. Getting that visa, you have to be there for some time and start going for directly attending walk-in interviews or directly approaching the hospital, something that from your end you should do it, and residing in UAE. Okay, that will create you more opportunities rather than sitting in India and applying for jobs. Okay, it is very important, have this financial stability for 3 months and take a break, get all the skills which are required. Okay, then you can go to UAE, and from there you can start looking for job. Within 3 months you can definitely land on particular job. Okay, then you can do whatever the things are necessary to continue there. You can work on that. Okay, so that is important. Without experience, and if you are not a doctor, without experience, I don't recommend you to go and stay in UAE. First, as soon as you get CPC certification, or if you not have CPC but you have enough work experience like 5 years of experience, 10 years of experience, okay, get the certification, and your experience is a add-on benefit. So move to UAE and start looking for job. Within 3 months definitely you can get a job. Okay, so this is my thing. And have a good, like, LinkedIn profile should be very much professional. Whenever you are reaching out to the people, they should at least able to recognize your achievements that you have done in the past company, or maybe having this good LinkedIn profile will always creates you more opportunities. And then yeah, target UAE first. Like you can target this DHA or DOH first, then you can move to Qatar if you want. Okay, so these are the things that we need to understand before we plan for UAE. Okay, so simply think like you, so many random messages I'll be getting. How can I move to UAE? Like they don't have certification, they don't have experience, so I cannot really tell them, yeah, there is so good like kind of you can make enough money, there is a lot of scope. I cannot really tell that. Okay, if you have skills, if you have credibility like certifications, you're a licensed coder, and you have some little bit of financial stability to sustain, even if you are not having job for 1 or 2 months, then definitely you can take a risk. You can go to that particular country and you can start looking and exploring the career there. And UAE has a good scope for medical coders, okay, and DRG coders. Okay, both OP and IP coders have good scope. Okay, along with that, just understand more details to insurance as well. Okay, so you can have a good opportunity there. Okay, that's why we always say in US also, UAE also, medical coding is becoming more popular. The only thing here in India, what's happening here is a lot of coders have turned to medical coding. Okay, like from past, after COVID, post COVID, so many graduates are not even looking jobs in their own sector. They're simply coming to medical coding. That is creating more competition. Okay, but medical coding remains same. Okay, that is one thing that I can say. So next thing will be, as you all know, I will be conducting 2 months of CPC complete classes. So the fees will be only 7,999 for 2 months, includes study material. If you are interested, please do WhatsApp me with proper details, or you can directly enroll using my website. Okay, and will start from June 18. And also early bird discount will be there for 7199. So you can, if you are interested, please reach me out. And if you want to know about the teaching skills, you can check my past videos, or maybe you can check the student feedbacks. Okay, or you can verify my LinkedIn profile and Instagram as well. So thank you all. I hope this video helped you little bit, and please do subscribe, and please do share with people who are required of this information. Thank you all.